34. Let's get over to Angela, find out what the latest in oral health care is here.
All right, thanks so much, Mark. Well, the Oral Cancer Foundation says more than 34,000 people will be diagnosed with this type of cancer this year, and only 57% will be still alive in 5 years. They say early detection is the key, and dentists may play an important role. Well, joining us this morning is Dr. Paul Coleman with a little more perspective. Thank you so much for coming in.
Good morning.
Good morning. So, oral cancer, it's something that people don't think about, but you're saying dentists actually, or some of them actually check for that all the time, part of our regular screenings.
Well, the good news is 60% of the public actually sees a dentist once a year. Unfortunately, only 15% think they're actually being screened for cancer, and it's something that's simple and it's life-saving and should be accomplished at every hygiene visit.
And you're not even really thinking about, because when I go to the dentist, that's not what I'm thinking about, but you're saying that a certain dentist do an initial check. What does that involve, and what should patients be asking for?
At a minimal, you dry the tissue, you look around for lumps, bumps, any kind of red or white lesions, any sores. Now the problem is a lot of these things will mimic very common things like canker sores, or someone that nips their cheek when they're chewing, or burns their palate on a pizza. So you have to be able to differentiate between the common stuff and the stuff that's not so common.
And we have some of the symptoms right there that people can also check for themselves, but obviously you're saying with you guys you do a follow-up and you look specifically. Talk about that.
Now if you want to just check things yourself, any sore that doesn't heal up in your mouth in 2 weeks should be investigated. Any lumps in your cheek, white or red patches, sore throats, numbness of the tongue or mouth, swelling of the jaw that would cause dentures to not fit as well as they once did should all be investigated.
Got it. And obviously if you do notice something, you can go to your regular doctor, or if you notice something, you're saying that's part of the regular checkup.
In my office, it's standard.
It's standard. But then once you do notice it, then there's also follow-up things that you can do. What should people be asking for?
Well, recently there's been a couple of things that came on the market. About 5 years ago, there's actually a brush that you can scrape any suspicious lesion, do a smear, send it into the lab. There's a computer that analyzes atypical cells within that sample, and if it shows up as some positive or atypical or cancerous type cells, it gets looked at by an oncologist who then notifies the dentist that this needs to be biopsied.
I see. And the biopsy, you're saying these types of tests are not too expensive. How much do they range?
Brush biopsy is only about $75. If it does come back positive, then you have to get involved with some type of biopsy, excisional or incisional or punch biopsy, generally performed by an oral surgeon. There is another product that just came on the market called Visiolite, where the patient rinses with this type of solution, and then a light stick is applied inside the mouth, and it will show up lesions before they're ever evident. Now the problem with this is, to the best of my knowledge, it still hasn't got ADA acceptance, and it's not covered by insurance. So to routinely do this on all patients, there is going to be some resistance on the part of some patients to do it.
All right. So early detection is the key, and maybe ask your dentist if they're doing any type of screening, or just keep a close eye on it yourself.
Absolutely.
All right. Thanks so much, Dr. Paul Coleman, for coming in. If you guys would like more information, you can